This video is for training purposes only. This video shows elective ankle surgery site disinfection according to Finnish guidelines. If you have any questions or concerns about steps outlined in this video, please consult with a qualified healthcare professional for guidance. The principles of surgical site disinfection according to Finnish guidelines are: the surgical site should be clean. The disinfection is done starting from clean area to dirtier area. Remember to think about the flow of disinfection liquid. The surgical site is disinfected at least twice. The disinfection area is made smaller with each disinfection. Be careful that glove or the forceps does not touch the skin. If the cotton balls touch other places than the disinfection area, they must be changed. Avoid being on top of disinfected area. Let the disinfected area dry before covering. The disinfection of the surgical area is done after the administration of anesthesia, either general, regional, or local. The circulatory nurse in the operating room is responsible for surgical site disinfection. The circulatory nurse in an operating room wears nursing scrub, head cover, and mask. They use gloves where needed, such as while disinfecting. The circulatory nurse puts the patient into suitable operating position. That is, the patient is laying on their back and the operative leg is supported by a leg rest, making sure that toes, knee, and femur are in straight line. This position helps to prevent the patient's leg from sliding during the procedure. The underpad is laid underneath the patient's operative leg. This is to prevent antiseptic solution dropping onto the operating table. The circulatory nurse gathers the materials needed to disinfect the surgical site. The things needed for ankle surgery site disinfection are colored antiseptic solution 60 to 80% ethanol, factory disposable gloves, hand disinfectant, cotton balls package, and dustbin. Now, the nurse disinfects the hands before opening the cotton balls package. After disinfecting her hands, the nurse carefully opens the cotton balls package without touching the cotton balls. It is important to disinfect the surface of the table before opening the cotton balls package. Then the nurse pours the disinfection solution onto the cotton balls from the top without any leakage. The nurse disinfects the hands and puts on factory disposable gloves. Then the nurse takes a pair of cotton balls, touching only the back side of cotton balls. This is because while disinfecting, only the cotton balls can touch the operating area. The nurse squeezes the extra amount of disinfectant and starts the disinfection process from toes. The nurse disinfects the toes using both hands. The nurse takes cotton balls on both hands and disinfection starts from big toe to small toe. The toes are disinfected individually with the circulatory nurse applying disinfectant in each toe and paying close attention to the spaces between them. The disinfection area should be wide enough, so the nurse starts disinfection from top of the bridge of the foot towards the knee, stopping just below the knee. Always remember to disinfect all parts so that there are no dry spots. Disinfection is done with one direction rule, meaning the cotton balls are moved only in one direction and not in back and forth motion. While disinfecting the calf area, remember that the cotton balls cannot touch the underpad. If the cotton balls touch the underpad, then the cotton balls must be changed immediately. It is avoided to be on top of disinfected area, so the disinfection is done from each sides, covering all parts. Now the nurse disinfects the sole of the foot. The nurse straightens the sole by holding the big toe with one hand using cotton balls and starts to disinfect the sole from top to bottom, covering the heels. The disinfection is done at least twice, so the nurse repeats the same process starting from the toes, but this time making the disinfection area smaller. Lastly, the operative area, that is, the ankle, is disinfected one last time, then the disinfected area is left to dry. Once the disinfection is done, the circulatory nurse carefully removes the underpad without touching the disinfected area and puts all the disposable equipment in mixed waste, takes off protective gloves, and does the usual hand disinfection. It is important to maintain aseptic principles during disinfection. If there are suspicions regarding inadequate disinfection or contamination of the area, repeat the disinfection process as needed.